Um, yeah, so my name is Kwasi. I sort of felt unwell, I think around the 24th of April. I didn't know at that time that it was COVID at all. I think my partner gave me coffee to drink, and I thought it was water. At that time as well, they had not added taste to the COVID criteria. So we're not too sure. We didn't even think it was COVID because I didn't think that it was. But I felt generally unwell around that time, and she bought a temperature gauge, which my temperature was sort of ranging within the 39s at that point. So I think the Sunday, I was really unwell the Sunday, and she just felt that I'd got to a point where I think I was slurring my words. So she was like, okay, I think we need to do something about this. So we phoned NHS 111, and they put us in touch with Shop Doc, and then we were asked to go to Shop Doc the same day. Got to Shop Doc, and they did a few sort of tests, spoke to me, and they said, no, there's no way that I could go home. They wanted to sort of do a bit more investigating. Um, Went to A&E, did a few tests, did an X-ray, came back, and it was pneumonia. That was what they diagnosed me with first. And then I think a few hours later, they diagnosed me with COVID. Um, to be fair, to that point, and I think throughout to the point where I think I was put on the ventilator. I think I get my dates mixed up quite a lot because I think it felt quite long. Well, to me, it felt quite short, but then my partner says that it wasn't. I think it was the Monday. She's saying it wasn't the Monday. I think it was a few days after where I was put on the ventilator for I think, a good few days. I think maybe a week. So I was quite poorly. I woke up from the ventilator. I think, as I said, my dates, my time frame is quite mixed up in terms of how long I was on the ventilator for. But I woke up to sort of claps when I woke up because I think they were trying to get me. They were slowly trying to get me off the ventilator, and it happened in the end. For me, as I was in through from going from home to Shop Doc to waking up in the ward and the care that I got, to be fair, it was absolutely brilliant. Even though everyone was sort of masked up and you couldn't really see anyone's face, um, it didn't take away from the care at all. Had me come back, which I thought was absolutely brilliant. So to help me sort of be able to add up and to sort of put things together, they invited me back to intensive care. I met some of the nurses who were all masked up by then, so I could see faces now. Met a few doctors. They took me around the ward so that I could put things together to the point where I realized that there was no slushing machine in the hospital. I thought there was one when I was hallucinating. So that sort of really helped me to put things together. And they sort of explained where I was, what ward I was in, what room I was in. So that was quite a really good touch as well, where they sort of invite you back and so that you could sort of go through that journey again and make things clear in your head because I still had quite a lot of questions. And when I came out, and I think going back there really helped me to sort of put a lot of things to rest. Coming outside of hospital as well, I know she's here. Maybe she should get off screen if I talk about her. But absolutely brilliant. Physio for me, geez, I didn't even know physios to come to houses and do, but I had absolutely brilliant. I was pushed and pushed and pushed, and I attribute all my my strength now to Katie because every week she's like, no, we're changing it up. This is too easy. This is too easy. We're doing something new. So seriously, I had absolute support. But I think for me, it's just being able to meet someone, do what they need to do, but then I think also talking about and not digging in, but then talking about sort of, are you okay in terms of your mental health, physically, are you okay? Is there anything that as a service we can do? I was like, wow. You know, so for me, as I said, right through hospital, through my aftercare at home, I can't, there's no negative. I think the only negative was the counseling and the weight. But again, as I said, you know, Katie was there to save the day. So I am so better now. People see me and can't believe that I was a person who couldn't walk. I came on with a Zimmer frame. Um, and they're like, "How are you walking?" I'm like, listen, even my partner at one point went, "Jesus, you've got yourself," because she's like, I need that exercise myself.
We received the referral for Kwasi from one of the physios on Ward 17. I contacted Kwasi, booked the initial appointment, went out to see him at home. And he was really deconditioned and was fatiguing after, you know, really small activities at home that, you know, normally he wouldn't have even thought about completing. Things like making the bed, he would have to sit down and rest for half an hour afterwards because he was just so tired following it. Kwasi had told me that he was previously a football referee and did football coaching and was very, very fit and active. So I was like, right, well, that's our goal then. That's what we're going to aim for. You know, we're going to try and get back to that level.
I shouldn't have said that. I should have said something else.
Kwasi worked extremely hard. I was seeing him twice a week initially, and we started with some very basic exercises like, you know, standing on your toes, you know, holding onto a side and just doing some mini squats. And then each time I saw him, because he was so motivated, he was progressing quickly. So every time I went to see him, I was like, right, we're going to the next stage now, we were pushing and changing. And then as the exercises became more challenging, I was visiting once a week, then giving him a chance to kind of try to achieve each of those goals. And he did amazing. And I think one of the tell signs was when we tried doing jumping jacks, and Kwasi's balance and strength, everything was really deconditioned, and we had to start the jumping jack purely just by stepping our feet outwards and then stepping them back in. And then sort of 2 or 3 weeks later, there he was smashing these jumping jacks out without even thinking about it. And I said, so you could, you know, he really worked hard and progressed quickly. You know, he did really, really well. Each time I went to see him, so at the very beginning, he informed me that he was having nightmares and was not going to sleep most nights until sort of 4 or 5 a.m., which is obviously not conducive to, you know, good recovery. So we tried to sort out some counselling, some mental health support for him. And unfortunately, because of the pandemic, lots of services had been shut down. And so that was quite a challenge for us, was trying to find that out. So I sought support from and advice from my team leaders, you know, our service delivery managers, and we couldn't get any help through our trust. So we went across to MPFT and managed to get Kwasi assessed by them. I checked last night, I think it was about 4 to 6 weeks between my initial assessment and getting the assessment through counselling came through. But yeah, so we got that sorted. That was our only main stumbling block, I think. And then you mentioned earlier, one of the things about the pandemic was that anybody you met was all, you know, we were all masked up, had our full kit of PPE on. And that's how Kwasi had seen me. And then there was one day where I was outside my car in my uniform, putting my PPE on, and Kwasi just walked straight past me because he didn't recognise me without a mask on. So I think that's a really big thing. You know, we're so used to seeing people's faces, and then all of a sudden, all you see are masks. You know, it's difficult, and I think, but you did amazing. You worked really, really hard.
You did amazing as well. Yes, coming out of hospital, I think I was the first person in Telford and Wrekin not to have died of the ventilator. So it was very emotional for the staff in the hospitals as well. So I think that's why the video came about, where, you know, the day I was leaving, the head nurse in Ward 17, she said, just brace yourself. And I was like, brace myself for what? And she just brace yourself when we go outside. And I didn't even know there's going to be people lined up in the corridor. And I was like, oh, please don't. And they wheeled me back and forth about 3 times.
And I had seen that video on social media before I'd met you, Kwasi.
Okay.
So I'd seen it on Facebook, but hadn't put two and two together. I didn't realise it was you. And then when I met you on that first day, it came into conversation, and I was like, "Oh my goodness, was that you?" And yeah, I think you were the first person to leave ITU
Yes.
alive,
Yes.
surviving from COVID. So I watched the video yesterday again, and it is so powerful and emotional. And to see the change that to how far you've come, it's amazing, and it's so moving. It really is.
Yeah, because at that point I couldn't walk. I was like, I can't really watch it a lot. I just skimmed through it because I'm like, oh, geez, that was me in a wheelchair. I couldn't even walk. And they were quite emotional. I think for me that's where maybe again, I know maybe people will say NHS have paid you. That's where for me, I just feel they didn't have to do it. They didn't need to do it, but on the day they just all felt we've all worked together here. The first person to go home out of ITU, we all need to celebrate this.